I would like to talk to you about Asperger's and high-functioning autism in the female population. The most recent research suggests that there may be as many females with Asperger's as there are males. The signs and symptoms of Asperger's in females are often exhibited in a more subtle manner, which leads to missed or incorrect professional diagnoses, a lack of access to special education services and provisions in education, along with an increased potential for interpersonal and psychological difficulties in the adult years. Females that have Asperger's might be incorrectly assumed to possess a character disorder simply because they imitate children without Asperger's but use phrases inappropriately. It's not uncommon for females with Asperger's to go undiagnosed well into adulthood. Like heart disease, Asperger's is incorrectly assumed to be much more prevalent in boys, so doctors often don't think to look for it in girls. But some experts have begun to suspect that, unlike heart disease, Asperger's manifests differently and less obviously in females, and this factor is causing them to slip through the diagnostic cracks. The fact that many females with Asperger's are not getting an accurate diagnosis may have implications for the health and well-being of these girls. Some specialists predict that, as we diagnose more females, the profile of the disorder, as a whole, will change. Unlike males, Asperger's females seem to have less motor impairment, a broader range of obsessive interests, and a stronger desire to connect with others, despite their social impairment. It's very possible that there are currently hundreds of thousands of females with Asperger's, but they don't know it. So, instead of knowing that the difficulties they have experienced are not their fault, they may blame themselves for how their life is turning out. This is why it's important for us to learn to diagnose Asperger's and high-functioning autism in females. With the diagnosis, these females will have an explanation for their life circumstances, which will then give them a course of action to improve their quality of life. Thanks for listening.